G'day, welcome to Case of the Day. This one's an interesting one. It was the end of the year and a woman was visiting from another country. Her daughter brought her in because she had pain in the hip. I watched her walk down the hallway and there was a noticeable limp. While questioning, I found out that she'd seen a colleague and a very good chiropractor who then went on holidays and told her that if she had problems to see me. He did a good job, but then the second time she was in pain. And I said to her, well, I'll check you out. So what I did was suspect that there was hip involvement, maybe pathological, because you don't get better and then get worse for no reason. She saw a very capable chiropractor who was end of year, so there was no x-ray taken. She was from overseas looking for some pain relief, and so therefore you wouldn't generally x-ray these people for a routine reason, which is a silly word. There is no routine. The only routine is to take care of the patient. At any rate, I said she should go and immediately have a good x-ray view of her pelvis and with a focus on the hip joint, and for the radiology practice to be aware that I suspected some kind of pathology. She came back and the hip was, to her shock and surprise, bone on bone. We got into a pretty avid discussion and she was cursing the doctors back home. I won't say which country. I agreed with her. I said the doctors must have been negligent. They were saying, you're all right, don't worry. It's just one of those things and you'll be right. And I was genuinely a bit angry at her prior doctors, including an orthopedic specialist. This is what her hip looked like. The left hip and the right hip. No joint space whatsoever. In fact, I can't see one. Left hip, space, right hip. Fused. There's no joint there. So I said, you need to get orthopedic assessment as soon as you get home. I'll try and give you some pain relief, but there's nothing chiropractic can do for this hip. It's not moving, this joint. But I did give her some pelvic and spinal and neck assessment and made sure that was all okay. What happened next shocked me. She came back in the new year and managed to locate some old x-rays. Lo and behold, these were less than a year old. So I thought, I'm going to nab this negligence where she should have been informed of an osteoarthritic hip and lined up for a prosthetic hip, a replacement. Here's the x-ray. In 2023, a year before, sorry, it's backwards there because I flipped it. And left hip, fine. Right hip, not too bad. And you wouldn't replace this hip. So there you go. As you might see, whether you're a layperson or some kind of physician, the hip's pretty good. It's got a fair joint space. There's a minimal amount of osteoarthritic lipping. And I ran it by one of my very reputable radiology consultants. And he said, this is a case of rapid onset hip osteoarthritis. Rapid is the word. So clinical pearl is always use imaging, use recent imaging, comparisons, communicate with other professionals if you can, or get the patient to, and certainly it will benefit the patient to know that not only this is the diagnosis, but that it's rapidly advancing for some reason, and those reasons needed to be assessed. And she went back to Europe, and we might get an update at some point, but X-ray doesn't lie. Have a nice day.